What are treatment options for bladder squamous cell carcinoma? When it comes to bladder squamous cell carcinoma, or SCC, understanding treatment options is crucial. This rare type of bladder cancer makes up about 2 to 5% of all bladder cancer cases. It is different from the more common urothelial carcinoma. The primary treatment for bladder SCC is radical cystectomy. This procedure involves the surgical removal of the bladder and nearby lymph nodes. For patients with muscle-invasive disease, this approach offers the best chance for long-term survival. Radiotherapy is another treatment option, but it generally does not lead to good outcomes when used alone for bladder SCC. However, when combined with radical cystectomy as preoperative treatment, it may improve survival rates compared to using radiotherapy by itself. Despite this potential benefit, radiation is not typically used as a standalone treatment and is more effective as part of a multimodal approach. Chemotherapy for bladder SCC has limited effectiveness. Unlike urothelial carcinoma, bladder SCC often shows less sensitivity or resistance to standard chemotherapy regimens, such as gemcitabine combined with cisplatin or the MVAC regimen, which includes methotrexate, vinblastine, doxorubicin, and cisplatin. Current guidelines suggest that radical cystectomy should be performed without neoadjuvant chemotherapy because there is no clear survival benefit from chemotherapy before surgery in bladder SCC cases. Some studies indicate that adjuvant chemotherapy, which is given after surgery, might provide some benefit, but the evidence is not strong or definitive. Immunotherapy is an exciting area of research for bladder SCC. Treatments using PD-1 inhibitors, like pembrolizumab, are being explored. Early studies have shown promising results in reducing tumor size in localized bladder SCC. However, more research is needed to confirm the safety and effectiveness of immunotherapy before it can be considered a standard treatment option. In summary, the main treatment options for bladder squamous cell carcinoma currently include radical cystectomy with lymphadenectomy as the standard and most effective treatment. Preoperative radiotherapy combined with surgery may improve outcomes but is not universally applied. Chemotherapy is generally not recommended before surgery due to low sensitivity but may be considered after surgery in select cases. Immunotherapy shows potential but remains investigational and is not yet standard care. Because bladder SCC is uncommon and tends to have a poorer prognosis than other bladder cancers, treatment decisions should be personalized. It is essential for patients to consult with a multidisciplinary medical team experienced in managing bladder cancer. Ongoing research may expand future treatment options, but for now, surgery remains the cornerstone of treatment.